So let's talk about self-care. I bet when you hear that word, you're picturing bubble baths, maybe some yoga, right? Disconnecting for the weekend. And yeah, that's part of it. But what if I told you that simple idea is actually the heart of a huge, way more complicated story? We're talking healthcare, economics, even political survival.
I know, that sounds like a weird question. A face mask and a revolution. What did those have in common? But believe it or not, the difference between them gets right to the heart of what self-care really is, and what it's become. That's the big tension we're going to dig into today.
Okay, so to really get why self-care became such a huge thing, we first have to look at the problem it's trying to fix. And that problem, it's a big one. A massive crisis in accessing mental health care. I mean, for millions of people, getting professional help is just not going to happen.
And look, it's not just one single thing getting in the way. It's like a whole cascade of roadblocks. Research from Whittier College really breaks it down, especially for low-income folks. You've got the crazy high costs, no way to get to a clinic, and forget about taking time off work. Then you layer on top of that the stigma around mental illness and poverty, plus systemic issues in medical settings, and you've got a perfect storm. It makes getting help almost impossible.
But that's not where the story ends. As these gaps in traditional care got bigger and more obvious, some really innovative solutions started popping up to fill them. So, let's take a look at how tech and new community models are trying to step in and bridge that gap.
First up, telehealth. And seriously, this has been a total game changer. Think about it. By making appointments virtual, you immediately knock down those huge barriers: distance, transportation, trying to get time off work. Research showed that during the pandemic, telehealth just shot attendance rates way up for low-income patients. It seems like a simple switch, but the impact on access has been absolutely massive. And then you've got mental health apps. You know, we have a global shortage of psychiatrists, which is a huge problem. So these apps are basically putting treatment tools right onto your phone. They're a super accessible, low-effort way to get help with things like cognitive behavioral therapy or mindfulness, stuff that would otherwise be way too expensive or just unavailable. And the best part? The data shows they actually work. For a lot of people, they really do help reduce symptoms of depression and anxiety.
Okay, so it's not all about technology. There's also this really crucial safety net made up of community and government programs. You have organizations like HRSA and SAMHSA, and they run clinics that'll see you no matter what you can pay. Then there are groups like Mental Health America and NAMI doing amazing work with education and advocacy. And of course, programs like Medicaid create a pathway to get coverage. All of them together form this critical support system.
So while all this is happening, these formal systems trying to improve access, something else was going on in the culture at large. The whole idea of self-care didn't just grow, it absolutely exploded. It just rushed into the mainstream, filling this huge void that the healthcare system couldn't. And you can really see it happen on this timeline, which is based on some research from Smith College. So Google searches for self-care start climbing in 2015, but 2016, that was the flashpoint. Right around the US election, the term just crossed over, big time. One writer even called it the new chicken suit for the progressive soul. And by 2018, it was literally everywhere.
And this explosion, it really cemented a very specific picture of self-care in all our minds. Suddenly, self-care meant all these wellness activities, yoga, meditation, face masks, juice cleanses. It became this huge, highly commercialized trend. But here's the thing, that's only one side of the story.
Because behind that popular commercial version of self-care, there's a much deeper, much more radical history. And to really get it, we've got to look at the two very, very different faces of self-care.
Okay, so here's the big divide. On one side, you've got the retail trend. That's the individual wellness stuff, massages, face masks, that's sold to us so we can recharge and get back to being productive. But on the other side, you have its origins, and that's as a radical act. For marginalized people facing systemic oppression, self-care had nothing to do with productivity. It was a political tool for pure survival.
And honestly, this quote from the activist and writer Audre Lorde, it just says it all. She wrote, "Caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare." Wow. For her and for so many other activists, just staying healthy, physically and mentally, in a society that is actively hostile to you, well, that's a revolutionary act. It's about preserving yourself so you can stay in the fight.
All right, let's zoom way out for a second. Let's go from the cultural to the global. Because self-care isn't just an idea. It's a massive economic engine. And it has this staggering, kind of hidden value that you probably haven't thought about.
So let's just start with this number, $119 billion.
That's how much money, globally, self-care practices save healthcare systems every single year. That's money that isn't being spent on doctor's visits or prescriptions for things people can actually manage on their own.
And it's not just money. It saves an incredible amount of time. We're talking 1.8 times billion physician hours saved every year worldwide. That frees up doctors and nurses to focus on the most severe cases, and it takes so much pressure off of health systems that are already stretched to the limit.
The impact on productivity is just as mind-blowing. 40.8 billion productive days gained globally each year. Think about that. That means people are well enough to go to work, to show up in their communities, to just live their lives. The economic ripple effect from that is just enormous.
But here's a really important distinction. The meaning of all that economic value. It changes dramatically depending on where you are in the world. So in wealthy nations, self-care is often seen as the first treatment option, right? It's a way to relieve some of the burden on the healthcare system. But in a lot of low-income nations, well, self-care is often the only treatment option. That makes it absolutely essential for a person's ability to work, to earn money, to survive.
So where does that leave us with all this? We've got this huge healthcare gap. It's being filled by a cultural trend, which it turns out has these deep radical roots. And on top of that, it has a massive global economic impact. It's a lot. And it's pretty clear the conversation needs to evolve. We have to start looking beyond just the self. You know, there's this one sentence that I think really gets to the core of it all. In the absence of community care, self-care is insufficient. We're so often told that it's up to us as individuals to fix these giant society-wide problems. I mean, a face mask is great, don't get me wrong, but it can't fix a lack of affordable housing. It can't fix a broken healthcare system. Our individual actions alone just can't solve these massive systemic problems.
So the path forward really needs to look at the whole picture. It has to be holistic. Yeah, it starts with individual care, giving people the tools we've been talking about. But that's got to be supported by community care, strong social networks, peer support programs. And then ultimately, both of those levels need to be held up by system care. We're talking real structural change that makes sure everyone has fair access to the basic building blocks of a healthy life.
And that kind of brings us to a final thought to leave you with. Look, the whole concept of self-care, in all its different forms, is obviously powerful. But if we're constantly being told that self-care is the answer to all our burnout and all our stress, maybe we're not asking the right question. Maybe the real question we should be asking is, what systems out there need to be cared for so that we don't have to fight so damn hard just to care for ourselves?